Welcome back, learners. Once again, welcome to our learning session. And for today, I'd like to begin our discussion by inviting you to join me in this mission. Our goal is to provide free NCLEX RN application and review to 100 nurses. To help us achieve this, just watch and finish the ads in our videos. Thank you. So if you have any questions or if you may want me to discuss any of the topics which you are having difficulty understanding as you prepare for your respective tests, kindly send me your request through this email, mentor.raygapuz@gmail.com. And here's the disclaimer. So our focus for today would be on wound dehiscence versus evisceration. For those who are taking the NCLEX RN, don't forget the most important concept that you have to remember when you meet a question that deals with these concepts would be to identify your priorities. Since these are common complications of surgical interventions, it's very important that when a client is having wound dehiscence or evisceration, the RN should call for help. And when a client has evisceration, never attempt to reinsert the organs back into the surgical wound. The best way to deal with it is to actually cover the wound with wet, sterile gauze. Or the best way to do it is to initially notify the doctor and then position the patient properly and then cover the dehiscence or the evisceration with moist saline soaks, okay? And then check the client's vital signs and make sure that you are coordinating the preparations of the operating room for the surgical interventions related to these complications. So let's begin. So here's a functional concept. Surgical complications may include opening of the incision, which we term dehiscence, and protrusion of the abdominal organs or evisceration. To be a little more visual about it, pardon to those who are eating while watching this video. So we have here two common surgical complications. You have your dehiscence, the opening of the surgical wound, and of course, evisceration. It's when the organs come out of the surgical wound. In both instances, you need to notify the provider or the physician immediately and call for help. Then never attempt to reinsert the organ back into the surgical wound. Best way to do it is to cover it with moist saline soaks, okay, for both conditions. And then check the vital signs and prepare the client for OR. So once again, if you are shown this picture and you are asked to label this, remember, this is dehiscence. For those who are taking Prometric and HAD, don't forget this thing. And to contrast it with dehiscence, this is evisceration when your viscera, the visceral organs comes out of the surgical incision. That's evisceration. So using the knowledge we just gained, let's try to answer a sample question. Here it goes. After abdominal surgery, a client experiences several episodes of vomiting. The client tells the nurse, "I feel something just split open." The nurse assesses the surgical site and notes that the wound appeared like the one illustrated. So here it is. Okay. So the nurse would document this as, is this dehiscence, evisceration, gangrene, or telescoping? Okay, let's analyze. When you say telescoping, this is option 4. This is when a part of the bowels inserts into the bigger part, and this occurs in intussusception. Gangrene usually commonly occurs in clients with diabetes mellitus when you have tissues that die because of limited or decreased blood supply. Okay, then you're left with options 1 and 2. So option 2, you have evisceration. Okay, so when the organs or the viscera comes out of the surgical wound. Dehiscence when the surgical wound opens. Okay, so what do we have here in the illustration? You have an example. This is actually part, I think, of the intestines that came out of the surgical wound. So you have part of the viscera coming out. So this is termed evisceration. Once again, the priority, don't forget to just stay with the patient and then cover it with moist saline soaks. Okay, and then notify the physician. So once again, Here's your mentor Ray saying a functional concept a day keeps your NCLEX RN fears away. So if you love this video, please don't forget to subscribe and hit the like and bell buttons. And if you want to shut down the NCLEX at minimum number of items and pass it, and pass the HAAD, the DHA, or the prometric, or whatever nursing exams you are taking, share our videos to at least 3 of your friends, and we'll pray that you're going to get what you're wishing for. So let's learn together. Send in your request to my email mentor.raygapuz@gmail.com.